Alternative choices today on More to Life. It's estimated that more than 60 million North Americans now use herbal remedies. Echinacea, glucosamine, black cohosh, and ginseng. These once exotic terms have become commonplace in our everyday medical lexicon. But what do we need to know about these therapies regarding their safety and effectiveness, many of which have been around for thousands of years? And why has the Ontario government decided to regulate the practice of traditional Chinese medicine and acupuncture? Let's ask the experts in these fields. Jean-Jacques Dugoua is a naturopathic doctor with the Artis Health Centre at Toronto Western Hospital. JJ, I find it very interesting, the center that you work at. It's called the Artis Health Centre. I mean, how does naturopathic medicine fit in there? I mean, tell us a little bit about this.
Well, the Artis Health Centre is a clinic at the Toronto Western Hospital, and we're an integrated clinic. So we work with nurse practitioners, medical doctors, chiropractors, and massage therapists, physiotherapists, so on and so forth. And what we've done is we've pretty much provided an umbrella approach to health, so that whenever a patient comes in, they're able to sort of get the specialties of each one of the practitioners to maximize their health. So I think it goes back to that question in terms of why I think it's popular. I would say two things. I'd say one, the baby boomers, because the baby boomers are getting older, and also people want to live longer. We are living longer, and people want to live longer, but they want to live healthier. So I think they're looking more and more to CAM, to complementary alternative medicine. That's the acronym we sort of call ourselves. And they're looking to that more and more to help them live longer and healthier, so that you're vibrant when you're older, you're not just, being wheeled around and on a crutch and so on. The thing, too, is that people are looking to us because sometimes they need a solution outside of the box.
You know, it's interesting, since you bring that up and you say that you spend a lot of time. It was very interesting because I had a family doctor in, and he was saying that he felt mainstream medicine can learn a lot from alternative practitioners, because what he was hearing from patients is that, aside from whether the treatments work or not, they felt that the relationship that they had with their alternative practitioner was so important. They felt cared for, and they felt listened to, and that the practitioner took the time with them and took their complaints seriously. Is that generally true, do you think?
I would agree. I would say on average, when I meet a patient for the first time, it's about an hour and a half, 2 hours. So you get a good opportunity to develop a rapport. And what I find, too, is that as the relationship builds and we get more and more treatments, you start to get more and more pieces of the puzzle. And once you get the whole of the patient, you're better able to help them to prevent disease, to deal with their health complaints. Because in many cases, you get this thing I call, and you'll see this in practice, too. Well, Eric sees this too in practice. I call it the oops, out the door type of thing. Somebody will say, well, thank you very much, it's nice meeting you. They get up, and as they go out, they say, oh, by the way, I'm on blood thinners, or by the way, I had a heart attack last year, and I forgot to mention it. Exaggerating, but you'll get, and with a relationship and having more time, that's where these things come out, and you get, a very good picture of the patient's health.
Yeah, that actually is, it's humorous when you say it, but you're right. I've had other doctors say exactly the same thing. That is very true, that the most important question comes at the very end as they're leaving. Yeah. Okay, let's take another call here. We've got Terry Lynn, who's on the line from Peterborough. Hi, Terry Lynn.
Hi.
Hi, do you have a question or comment?
Yeah, I have a question. I have a 7-year-old son who is ADHD, and he keeps on taking a reaction to these different types of Ritalin, and they make him depressed, and they just give him big ups and downs. And I was wondering if there was something that I can take, or give him to take, that will deliver the same things that this Ritalin is supposed to.
So I just want to clarify. So your son has been diagnosed with ADHD, is that correct?
Yeah.
Attention Deficit Hyperactivity Disorder.
Yeah.
And he's 7 years old.
Yeah.
Okay. JJ, do you have a comment on this?
Well, first of all, in any event, I wouldn't recommend something like this. I'd have to see this patient. I'd have to see your son as a patient. Commonly, we look at lifestyle factors. You know, we'd want to do some improvement in terms of the child's diet. There's lots of aggravating things like colorants and sugars and so on that, you know, can affect or worsen the ADHD condition. Lots of support of the central nervous system through fish oils and so on. Homeopathy is effective too. So there's lots of things you could do to help this 7-year-old child with ADHD. It's the beauty of the type of medicine we practice. Yeah. It is individualized. You know, it's not so much cookie-cutter approach. We could say, do this, you know, help everybody. You know, each patient is an individual, and we treat them accordingly.
Yeah,
so it's the beauty of our toolbox that we use.
When you say that only, what was it, 10%? What did you say? How many?
I think 10 to 50. I can't remember the exact.
Actually tell.
Yeah.
And I've read literature on that too, that the majority actually don't tell their doctors that they're seeing a naturopathic doctor. But also stemming from that is, well, they're afraid because they think that they're going to be reprimanded, and then they don't actually tell which therapies they're using as well. Now, there must be huge problems we run into with that if you're not telling one doctor what you're taking and...
Well, the first thing is safety, right? The big concern is what if we're both working in different directions, or what we're doing is either combining and, you know, combining to an explosion, or combining and offsetting each other, right? Or either getting head-to-head or running in opposite directions. So the big concern is safety, right? We want to provide safety in our patients, and we don't want them to be taking medications that could be interacting with the herbs and supplements that we're taking. And if the doctors aren't aware of this, then they don't, you know, they don't know if it's safe to be prescribing these things or not. And also just for the patient too, you know, we'll try something, and if we find out it's not working, or the doctor will try a course of treatment and find it's not effective. But if it's, you know, if we're finding that we're not sort of on the same page, then the patient's not getting the best health care.
Many people would say, well, I don't feel comfortable. I mean, I know these medicines have been around for 1,000 years, but still, I don't feel comfortable just from an anecdotal basis that that's safe. You know, I want to see hard evidence, clinical trials and studies in order to make me feel, okay, this has been scientifically tested, and I feel better knowing that.
I would say for certain things it is there. Chinese medicine is a bit tougher to study because it's, in the case of the herbal medicine aspect, it's combination remedies and so on. In terms of the research world, you know, we always want to isolate. See what this does. But for example, if you look at St. John's wort, right? I'll go back to St. John's wort. St. John's wort has a systematic review and a meta-analysis. That's pretty much the highest level of evidence in the evidence-based medicine world. Its effectiveness for mild to moderate depression. So that means it's gone over all the randomized control trials, and there's been quite a lot. It's gone over all the case reports, all the courts, et cetera, and it's been proven to be effective. You know, ginkgo, same level of evidence in terms of dementia and Alzheimer's and so on. So we know there are things out there. It's a question of having people knowing that there is information out there. And I agree. You know, there's definitely, I agree that there is a lack of funding, and we need a bit more. We need a lot more resources put towards research.
So do you feel, though, that you know, whether they're all herbal remedies or whether they're drugs, you know, that mainstream doctors use, that these types of treatments all should undergo the same kind of investigation? Because we subject drugs, right, to these clinical trials and evaluations. Do you think that herbal remedies should also be under the same?
I think they should. It just depends on what exactly we're looking at. It depends on what modality we're looking at. Let's take St. John's wort, for example. The reason why we're very concerned about St. John's wort is because of these drug interactions. But we're concerned, yes, on the theoretical side, but also we've had case reports of women on birth control pills who've taken St. John's wort and they've had unwanted pregnancies. You know, we have concerns with people taking chemotherapy with St. John's wort. We have concerns because there are reports of lack of effectiveness with chemotherapy agents, lack of effectiveness with HIV patients and drug levels and so on. So the thing is, in research, it's on a researcher and a clinician, and the clinician is always ahead of the researcher, right? Because we're in the field, and yes, this may interact, you know, the match may interact with the gasoline can, but if you're managing and you're watching for interactions, and it's dose dependent also, right? Like sometimes you don't need to hit somebody with a bag of bricks to get the effect that you want, right? You just sort of taper and then you monitor accordingly. So it's lots of fine-tuning in the practice of medicine.
All right, let's go to our caller again. Audrey's on the line from Toronto. Hi, Audrey.
Hello.
Hi, go ahead.
Sleep medication.
I'm sorry, what was that?
Sleep medication.
Sleep?
Yes.
Yes.
To get 5 hours sleep, I've been taking melatonin. But I noticed that it says if you're taking it more than 9 weeks that you should consult a physician. So first of all, how effective is it? I find it doesn't put me to sleep, but it'll put me back to sleep. And is it dangerous?
Okay.
I can take it. It's funny, I think I had about 5 insomnia cases in December before the holidays.
Right. I thought is melatonin approved here?
Yeah.
Oh, it is approved.
Yeah.
Okay.
It's 2 years ago,
Okay.
I think,
All right.
roughly, give or take. It's used a lot in cancer treatments.
Okay.
I usually don't give hormones unless it's a last resort. Melatonin I usually give more for treating jet lag.
What is melatonin?
Oh, I'm sorry. Melatonin is it's the sleep hormone. It's a synthetic version of the hormone that your brain naturally produces. It comes from the pineal gland. So one of the I guess options of treating somebody with insomnia is to give them melatonin, and should in theory put them to sleep. It doesn't always work like that. So there's many options for insomnia. It's one we look at sleep hygiene. That's a big thing that's never really discussed in treatment.
Sleep hygiene? How clean you are when you go to bed?
Clean sheets, clean pillows, clean thoughts.
Clean thoughts. Okay.
Well, no. For example, regularity of sleep. For example, do you go to bed and wake at a regular schedule? Because your body works in a rhythm. It's a circadian rhythm, right? So the more you get into rhythm, the more your body functions better. For example, you will secrete more melatonin naturally in your brain, somewhere in here, when you sleep in complete darkness. And I speak to patients and I say, yes, I sleep in complete darkness. I say, great, well, can you see your hand in front of your face? Right? Well, no, I can see the street lamp outside. It doesn't work like that. If you get exposed to light when you're sleeping, you don't secrete as much melatonin. So, just...
Really? Generally, we would have a better sleep in total darkness.
Exactly.
Oh.
Yeah,
Now, she asked, is it dangerous? Are there side effects with using melatonin?
Grogginess. There can be some concern. She should be followed if she takes melatonin. It's not something she should just be taking like that.
Coffee now has been shown to reduce certain rates of cancer. So there's a variety of lifestyle habits that we have that can impact risk factors for cancer.
Yeah. Do we actually know that? Seriously, that it has a direct result on,
well, for example,
cancer?
Oh, well, for example, like at shift workers, they did the study in Sweden when they looked at night shift workers, people that had their whole circadian rhythm flipped around and a higher incidence of breast cancer. So we hypothesize it's due to the melatonin production. Do we know enough yet? Well, no, we need to research it more. Like I said, the clinician is always ahead of the researchers, but no, I definitely see a correlation.
Okay. All right, let's go to another call here. Anna's on the line from Toronto. Hi, Anna.
Hi.
Hi.
I have 2 questions I wanted to ask.
Yes.
One is in regards to the silica pills, the horsetail herb.
I'm sorry, can you repeat that?
Horsetail herb.
Horsetail herb. Okay.
And I wanted to know if it can make a person's blood pressure go down. That's one. And the other question I wanted to ask is that many naturopathic doctors use a person's blood type to either help them, treat them, or change their diet. Do these doctors use that?
I'm sorry, use what?
Use blood type.
Do they, these are doctors, do they use blood type? Okay, let's start off with the first question then, horsetail herb. Who would like to? Yeah, okay.
I wouldn't be my first usage of that herb for
what is that
reducing blood pressure. It's Equisetum arvensis. Thank you. My Latin is still sharp. Usually we use it for its silica content. It's not, as far as I know, it doesn't have a hypotensive effect. Maybe a mild one, I don't know. It's somewhere at the back of my brain. But it wouldn't be a go-to for lowering blood pressure.
No. So what would you suggest?
Typically for blood pressure, not that I recommend you take this at home. Typically blood pressure, I always start off gently with fish oils or magnesium. With anything such as blood pressure, there's always a lot of regulating. So whenever I have to regulate hormones or blood pressure, so on, start gentle. Lifestyle changes, if that does the trick, that's great. If not, then I head to more aggressive things such as hawthorn berry, so on, which there's some other stuff too that I won't name it because I don't want patients to go and take it.
You want them to see you first.
No, I just don't want them to take it because there is, what's commonly misunderstood, and I've chatted with this about doctors, is that a lot of medications, I would say about, and it's about the last 25 years, I think the percentage is about 45% of drugs have come from plants. So it's a misconception that plants aren't as effective, aren't as strong, and so on. In a lot of cases, medications come from plants. Aspirin was synthetically derived from white willow. Digitalis, very, very potent medication for congestive heart failure, comes from foxglove, which is a weed that you'll find on the highway. So you get some pretty heavy-hitting herbs, and with some of them, we're dosing 8 drops a day to drop somebody's blood pressure. So it's, you know,
Okay.
yeah.
And I really want to know, what is the state here of echinacea to either prevent or treat colds? Because I've seen so much conflicting literature on this. And the latest was actually negative. I think it was it was a study in the New England Journal of Medicine that said echinacea was useless in preventing and treating colds.
I guess it's back to the idea of research, the importance of research and evidence-based medicine.
Yeah.
We know from systematic reviews that echinacea is effective to relieve the symptoms of colds. It shortens colds and it reduces a lot of symptoms such as headaches, stuffy nose, so on and so forth. Conflicting evidence in terms of its effectiveness in terms of preventing. So that's what we know in terms of the research. One of the tricky things with the research is that you can't, a lot of people just tend to sort of look at it as it lands on the pile. So it's on top of the pile.
Yes.
Throw it out.
Yeah.
The rest of the pile is useless. You can't do that.
Right. You have to look at the body of evidence.
You have to look at the body of evidence. So it is effective. I generally don't use echinacea on its own. I usually use it in combination. There's lots of immune-stimulating herbs. Some are more antibacterial, some are more antiviral, some are antiparasitic, some have different effects on the immune system. So I usually give them an immune-boosting combo, that may contain berberine or berberine that comes from berberis.
Okay.
Echinacea, of course. Off the top of my head, lots of vitamin C, so on and so on.
We're quickly running out of time here, and I definitely wanted to touch on the fact that right now the naturopathic medicine, industry, naturopathic products, great transition right now, right? There's a lot of change happening. Can you update us on, what exactly is happening with labeling and licensing? And I guess I take it from the consumer's point of view, where people they're still going into their drugstore. They're trying to decide, okay, well, what should I buy? Which brand? How do I know that when it says this much active ingredient, that's what I'm getting? JJ, can you comment?
I believe it's by 28 or 2010, 2008 or 2010, I forget. It's when pretty much everything is supposed to be up to par. It's being done through the Natural Health Product Directorate.
Yes.
What they're doing is they're requiring site licensing, distributing licensing, so on and so forth. It means that each product will get a certain registration number.
Right.
We call it NPN number and so on. And what they're going to require people to do, the companies that manufacturers are going to ask for third-party testing. And they're also going to make sure that they have good management practices that ensures that what they say is on the bottle is in fact in the bottle.
On the bottle?
But I mean by third-party testing is that, say I produce a bottle of product X, an independent lab tests it to ensure that it contains 100 milligrams of A, 200 milligrams of B, so on and so forth.
Right.
So they're tightening.
Thanks to all of you for coming in. Very informative. Thank you very much. Now you can reach Jean-Jacques Dugoua at the Artis Health Centre. That's at Toronto Western Hospital, and the number is 416-603-5263. The website is www.uhn.ca, and he's also at the TrueStar Health Clinic at 647